Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. We're talking about diabetes, a condition that affects 30 million women, and it's a condition that affects women a little differently than men. We went to the UMass Memorial offices in Northborough to get answers. Can you explain the difference between diabetes in women versus diabetes in men?
Basically, the symptoms of diabetes in men and women are very, very similar, but there are some symptoms that are unique to women. The similarities are that patients come complaining of increased urination, increased appetite, weight loss, thirst, recurrent skin infections, poor wound healing, fatigue, nausea. Those are some of the similarities. As I said before, there are certain symptoms that are unique only to females, and one of them is vaginal yeast infections, oral thrush, recurrent urinary tract infections, polycystic ovarian disease, and depression.
What is the difference between type 1 and type 2 diabetes?
As we all know, diabetes is rampant in this country, whether it's type 1, whether it's type 2. Worldwide, there are over 300 million cases of diabetes. And in the United States, 12 to 14% of the population has some form of diabetes, either type 1 or type 2. Again, there are similarities and there are differences. The similarities being that blood sugars are uncontrolled in both settings, and that can lead to health complications. The differences are type 1 is generally diagnosed in patients who are younger, like children or teenagers. Type 2 is diagnosed in older people, people over 30 years of age. In type 1, the mechanism of the disease is slightly different. It's an autoimmune disease where our own body produces antibodies that start attacking the insulin-producing cells in the pancreas. Because of that, there is no insulin production in the body at all, and patients have to give themselves insulin to stay healthy and to control your blood sugars. In type 2, the mechanism is slightly different. There is insulin in the body, but the body's tissues and organs are not responding to them very well. In other words, there is insulin resistance. In type 1, when the patients are diagnosed, they are usually thin and underweight. In type 2, the patients are overweight or obese. In type 1, you absolutely need insulin to control your blood sugars. In type 2, initially we can try a trial of diet, exercise, and weight loss to try to control your blood sugars. We can graduate to oral meds if the blood sugars are not well controlled. But in many cases, we have given patients with type 2 diabetes insulin as well in order to control their blood sugars. Let me make a point here. Sometimes it's very, very difficult to differentiate and diagnose type 1 and type 2 diabetes, in the sense to differentiate between the both of them. And a lot of times your doctors have to run special blood tests in order to differentiate between type 1 and type 2. So it's not easy to make a differentiation all the time.
What can women do to reduce their risk of developing type 2 diabetes?
As a woman physician, I frequently advise all my women patients all the time to be very careful about their diet, to be careful about the amount of sugars they consume, processed foods, also to limit the amount of fat and oils that they use in their diets, to exercise very regularly, 3 to 4 times a week at least, 25 to 30 minutes, as much as their body tolerates, not to lead a sedentary lifestyle. Also, if you have a history of high blood pressure, to control your blood pressure optimally, I would recommend a blood pressure of under 130/80. If you have a history of high cholesterol, to control your cholesterols really well, take a statin after consultation with your doctor's primary care doctor. But generally, having and leading a fit, healthy life, having a nutritious diet, avoiding a sedentary lifestyle, and controlling your blood pressure and cholesterol is the key.
If you're a diabetic, are there complications to using birth control pills?
So here in Northborough, as our women patients come in and I find that they are diabetics and using birth control, I give them the following advice. Often birth control pills can lead to uncontrolled blood sugars and can cause a lot of fluctuations in blood sugars. So make sure you check your blood sugars several times a day as instructed by your doctor and report the numbers to your primary care or your endocrinologist. Also, if women who have diabetes have been on birth control for a year or two, If they have existing complications of diabetes like eye disease or renal disease, and they develop high blood pressure because of the use of birth control, those complications can be aggravated. So your existing complications related to diabetes can get aggravated over time with birth control use.
What should diabetic women look out for before and during pregnancy?
Here in Northborough, we see a few patients who are diabetic and who plan on getting pregnant as well. So it's a very challenging situation for them because we need a nice, healthy outcome for the mother as well as for the child. That's our goal. I tell my patients to have very, very good blood sugars, glycemic control, even before they get pregnant. So pre-pregnancy, get your diabetes under control. Work with us, work with your endocrinologist, and we will help you achieve that goal. Once you get pregnant, again, very important to control blood sugars, keep them extremely tight to have healthy, good outcomes. The American Diabetic Association recommends that diabetic pregnant mothers check their blood sugars very, very frequently, as many as 8 times a day. So please check your blood sugars frequently as instructed by your doctor and report those numbers back to your doctor or your primary care so that we can ensure that you're having good glycemic control. Also, I tell women who plan to get pregnant or are pregnant to watch their diets very closely, reduce the number of calories that they intake, and also to reduce the amount of processed foods that they eat.
How can menopause affect diabetes?
Here at Northborough Crossing, I advise all my female patients who are diabetic and who are going through menopause to be extremely careful about their blood sugars. During menopause and even sometime before menopause, there can be many hormonal imbalances and hormonal surges that can cause surges in blood sugars and fluctuations in your blood sugars. So be careful at that time and check your blood sugars as instructed by your doctor and report any abnormals to your doctor.